Everyone involved in the mental health, addictions and disability sectors wants service users to receive the best support and achieve good outcomes. Research shows there's a 17-year gap between where knowledge of best practice emerges and when it's put into practice. Knowledge exchange tools help us bridge this gap. The Mental Health Commission of Canada developed Spark, a knowledge exchange training program to support the mental health and addiction workforce to use knowledge to change practice within their organisations. Spark New Zealand gives participants the foundations to develop a simple knowledge exchange plan using the Innovation to Implementation framework. It also gives participants the opportunity to collaborate on knowledge exchange across the sector. The Innovation to Implementation framework is a practical 7-step process for moving from innovation to implementation while increasing uptake of evidence into practice. Step 1. State the purpose of your plan. Step 2. Select the innovation around which your plan will be built. Step 3. Specify the actors and actions. Who needs to do what differently? Step 4. Identify the best agents of change. Who should be delivering knowledge about this implementation? Step 5. Design your plan. Step 6. Implement your plan. Step 7. Evaluate your plan. TPO, with support from the Mental Health Commission of Canada, implemented Spark New Zealand in March 2013. 3 participants share what Spark meant to them and how they applied the Innovation to Implementation framework.
I think the main benefit of the Spark NZ for me was the fact that it wasn't just a one-off 2-day course and that was the end of it, which is so usually the case, but that we were linked in with our group and with the support of our mentor. So over a period of 9 months, there were repeatedly touch points where we were linked back in, which really helped us maintain enthusiasm, remember that we were working on it because you got lots of other things to do, and bring it to fruition so that the thing you wanted to achieve, you did achieve.
The actual structure of the process was really good. It kept me on track and encouraged me to keep going.
So one of the things that became apparent to me when I started thinking about Spark and became engaged with those ideas is the way that we were running projects through our DHB in mental health and addictions wasn't the most efficient way that we could be doing it. This wasn't news to the organisation, but thinking about Spark and how things move from knowing to doing, I realised that the way we ran projects was just simply not efficient. We had lots of projects happening, lots of enthusiasm, lots of people wanting to affect change, but there was no real clear process. So I kind of had my own agenda for looking at that process because I wanted to run my Spark project through in a way that could be implemented.
So at the start, when we selected the innovation as part of the 2-day training for the Spark NZ, the best thing about that for me really was having the opportunity to meet and work with people that were really experienced high-level clinical professionals, and many of them also working in areas of policy and research that I wouldn't normally really be interacting with. And from my point of view, it was the fact of working closely with them. So they were advising me on the project that I was working on, and it was reciprocal, so I was also commenting and advising on the projects that they were working on. It was quite unusual and a great opportunity.
One of the things that became really exciting about this project is that when we put the project scope out within the DHB, people across all disciplines put up their hand to be involved. And that really meant that we had probably, I think for the first time that I'd ever seen in 6 years, not having to drag people in and say, well, you need to be involved in this because it's going to affect you, but actually people saying, yeah, this is interesting, we want this to happen. So that was a huge difference actually. Yeah. And one of the really good things I got out of Spark was that I presented this my project to my peers, to other family advisors, family whānau advisors up and down the country, and they were really excited. They were excited not so much about me saying, oh, we need better partnership family meetings, because they already know that's not news, but that I could say, look, I know we need that, you know we need that, but this is a way that we can actually move what we know needs to happen to what can happen, to make people change practice, to help people change practice.
After I'd worked out my plan and started to try and carry out the different steps of the plan, I was finding it really difficult to bring it to fruition. And one of the reasons I realised was that I didn't have an enormous amount of influence on some of the people that really needed to affect the change. When I was talking to my mentor about this, I happened to mention that some of the skills and strategies that we'd learnt in Spark NZ, I'd naturally been applying to other tasks in my work. And this led to a conversation about perhaps I should just change, for the purpose of this project, change the plan to one that I was already doing, because I'd already been using that structure and technique to plan and bring that one to fruition.
One bit of the project that was quite interesting is we formulated in our project group this new way of running family partnership meetings, and I was kind of horrified to find out that some people had already started to do it, because that's kind of against the model of implementation. On the other hand, what I noticed was it was working really well, and when I did the file audits I could see much more documentation, much more satisfaction from the consumer, from the family and from clinicians. So it's kind of, okay, we started to do it, but tie-ho on that a little bit and we'll get back to it.
Being in the Spark project was one of the best things that I was involved in last year. It gave me a great focus and a sense of purpose, and it's something that I think I will carry with me, the learning and the connections that I've made, and it's just put my thinking into a new paradigm, and I hope that that will be really beneficial for the future.